But we begin in Vancouver with the mayor's call to decriminalize simple possession of all drugs. Mayor Kennedy Stewart has the support of the police department in his city, as well as city and provincial public health officials. Now he needs the federal government's approval. A motion he unveiled today will go before City Council next week. If it is passed, the city will ask the federal government for an exemption from the Controlled Drugs and Substances Act. The goal is to address the opioid epidemic and the toxicity of street drugs. Vancouver has had more deaths from overdoses this year than from COVID-19. Mayor Stewart joins us now from that city to discuss his push. Welcome back to the program.
Hi, thanks for having me.
I want to talk about the concrete impact of this. Federal lawyers have already been directed to avoid prosecuting simple drug possession cases unless there are major implications for that. Police, you have indicated in your city, are rarely arresting people for simple drug possession. So what would actually change here?
Yeah, well, let's set the context. I mean, this year we've had 328 deaths due to overdoses. Our drug supply here is totally poisoned with opioids. 99% of the drugs on the street are laced with fentanyl or carfentanil, and essentially that means there's overdoses all the time with 328 deaths. That's one a day. And so we've been trying a variety of measures to reduce both overdoses and overdose deaths. So safe supply has slowly been rolling out, and we can talk about that in a second. But decriminalization now, there seems to be, from the premier, from the police, from the health officials, there seems to be a consensus, I guess most importantly from the community itself, that this would help mostly because it would reduce stigma. The reason people are overdosing is because they inject on their own, use drugs on their own, overdose, and there's nobody there to call for help or revive them. If we destigmatize drug use, it will move people into the more mainstream healthcare system, and that should reduce drug deaths.
I take your point about stigma. You're suggesting that people fear they will be arrested. And I'd like to know how many people this year, for instance, have been arrested in Vancouver for simple drug possession.
It's a little more complicated than that, but so what we've done here in Vancouver, the VPD has essentially done a de facto informal decriminalization. So if people are caught with small amounts of drugs, they're not sent to the Crown prosecutor. There's no charges. But that, suggested against them. But of course, that doesn't really reduce stigma because people are still, especially, there's a wide variety of people, but those are, for example, casual users are not going to be, or new people are newly addicted are not going to be talking to their friends and family about their addiction, and they're going to be using alone.
But I want to be clear, pardon me, Mayor, I want to be clear about the impact. What I hear you saying is this is not about arresting people at all, that the impact you believe this has will be virtually entirely stigma related. It's not about that.
Okay, but the other thing that happens now is that if you're stopped by the police, they can still take your drugs because they are illegal substances. So if we decriminalize that, the possession of drugs will stop. And I think that is an important step that this will also address. So no charges, but also no seizure. And of course, small quantities of drugs for personal use.
Okay, this is obviously, it all hinges on the federal government. You've expressed a lot of optimism from what I've heard today about the idea that Patty Hajdu will indeed, and of course it is beyond just the health minister, it's going to involve numerous ministers, certainly a decision by the Prime Minister as well. What makes you so sure that the federal government is going to say yes to this, given the comments that we've heard from them thus far? They always say, listen, this isn't a silver bullet, there are other things that we can do more quickly.
We've done it before, so that's why I'm optimistic. Vancouver brought in the first supervised consumption sites back in the early 2000s. Those required exemptions. They took a while to get through, and we're constantly challenging court, for example, by the Harper government. But those passed and have held. We think this is basically a similar exercise where it is a cabinet decision. It's not any kind of legislation that has to go through the House and the Senate. This is something that can happen before the end of the year. And again, I'm very, I've had very positive informal conversations with the health minister, who is herself an expert in this area. So very optimistic that
Can you pull back the curtain a little there? Like what has she said that's made you so optimistic?
Well, I happened to be in Ottawa when the cabinet was sworn in, and we actually ran into each other in the hallway. We've had, we both have, folks in common that we know that are advocates in this area. And so I know that the minister is a proponent of harm reduction in general, was very supportive. And in fact, instrumental in us getting Safe Supply off the ground here. And so I'm hopeful that she'll be able to convince her colleagues that this is the right thing to do.
We did get a statement from Minister Hajdu's office. I'm just going to read a little bit of it. She says, we will review this request to address criminal penalties of simple possession of small amounts of controlled substances, and will continue to work with Canadians who use substances to ensure they get the support they need. She also talks about working with officials in British Columbia. What happens if the federal government says no, though, Mayor Stewart?
Well, I mean, I'm hoping they don't say no, but what we have to do is work on the other fronts is with Safe Supply, for example, that again, it allows prescribed substitutes for illicit drugs. That is slowly getting off the ground here in British Columbia, but we need more investment from the provincial and federal governments. And also, the medical profession also has to embrace this with open arms. We have some doctors that are taking this up. So, I mean, this is one front I'm pushing on. There's multiple other fronts that I'll continue to push on. But all I think about is that tomorrow when I wake up as mayor, there will be another person who's died of an overdose here in the city, and that is totally unacceptable.
Part of this discussion, I think, has been, or maybe it hasn't been part of the public discussion, but obviously there's politics and I guess political acceptability in all of this. You talked today about the fact that you think the Vancouverites are generally on board with this, but you're asking the Prime Minister of Canada, the federal cabinet to engage. We looked at some of the opinion polling. There was one online poll from January by Ipsos that suggests 53% of Canadians oppose decriminalization. How do you propose the federal government deal with that level of public opposition to an idea like this?
Well, this is the perfect answer in doing it at the city level, where we believe we have the authority to do this, because we have done with consumption sites, is let us try it out. We have a very supportive police chief who is the head of the National Association, who is a proponent for this, as well as Safe Supply. We have the most experience here. The Premier himself has written a letter to the Prime Minister on this issue, like, we're ready to go. So if there was ever a time to trial it, it's right now, and it's in Vancouver. And we're willing to share everything. Of course, it's always a scientific approach, documented with data. I do talk with mayors across the city, across the country frequently. They're starting to see opioids sneak into their drug supplies. They're starting to get the same, not the same level of overdoses, deaths, but similar levels. And this isn't stopping, and it's coming to a city near you. So I think this is a perfect opportunity to try new tools, and this is what we should do.
We are essentially out of time, but it's more or less a yes or no question, Mayor. You would expect other cities to follow suit then? That's your hope in the longer term?
I would hope so. I mean, it's been tough with consumption sites where premiers are kind of hot and cold on those. You establish them in Alberta, then you tear them out. I mean, and then people die. Like, that's what it comes down to, is people dying. And a lot of times this is where the stigma comes in place. Like, we have deaths all over our city from all kinds of different income levels and all kinds of backgrounds. And so this isn't, every life is important, but I think you have to know what a widespread epidemic this is. Why the province declared a health emergency in 2016. We've had 1,500 people die here of drug overdoses since 2016, and thousands of more overdoses. So, we've got to get the spotlight back on this, and we've got to do everything we can, and this is a good step in that direction.
We're going to keep following it closely, and we hope you come back on the program, Mayor, when you hear one way or the other from the federal government. Thank you for your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.